Hi, my name is Sarah Setzer, and I'm an occupational therapist assistant student at Lackawanna College, and I'm here to talk about the need to design a community and primary care program that supports occupational performance for persons, groups, and populations. So we all know that primary care is important. It's needed for preventative care, to treat illnesses, and there's also been a need to address behavioral health as well. Since the Affordable Care Act has been implemented, there has been a big increase to manage chronic conditions, to reduce costs, and improve population health, which really goes to show that occupational therapists should be in primary care because one of our philosophical bases is population health. Sadly, primary care has been lacking in the occupational performance area. Say somebody is given a medication, they might not understand what it's for or why they need it. The doctor might have explained to them, but it didn't click. So, them not understanding why it's important, they may not take it. And sadly, this can lead to hospitalizations. But with occupational therapists, if there's a question, if they don't understand, occupational therapists can explain why the medication is important and help them implement a routine to taking this medication. If the doctor suggests something, occupational therapists can help people reach that, be it through dietary needs, if they have diabetes, medication management, physical needs, or transportation, just some examples. OTs understand chronic and acute conditions. We learn it in school. We understand what can happen with these diseases. So we know how to offer suggestions and give support. We also know how to address the impacts of social determinants of health, like housing or transportation or finances. And we understand that if somebody doesn't have a place to live, they may not be able to get the medication they need or have a safe place to be healthy. Occupational therapists also understand the relationship between occupations, functional performances, and health. And we see that if a person can't do their occupations, they're not as healthy. They're not able to clean themselves. They're not able to do their daily activities, their ADLs or IADLs, which can lower their health. We are masters at addressing these, at self-care, functional deficits, life factors. We understand this. This is what we learn. So putting us in primary care, we know how to address all this already. A doctor or a nurse doesn't have to learn how to do this, and it's hard. It's hard to think like an OT because we're all about treating people through things they do every day, and that's not usually how medicine works, at least not traditional medicine, which is why occupational therapy is so important, and is why it should be considered into a program and in primary care, because with OT in primary care, we can address all those stages. We can address different developmental stages from children and adolescent to young adults to middle adulthood to late adulthood. We know how to treat everybody. I mean, obviously there's, sub-skills like pediatrics and geriatrics, but we learn broadly and we know how to treat people and we know how to offer suggestions and offer this support. It's why occupational performance should be addressed in primary care, because it's one thing to give a person medication and to treat the illness. It's a whole other to treat the patient and have them be healthy and happy and involved in what their treatment is. And that's why OTs should be in primary care and why primary care should be implement occupational performance.